People are often surprised when they open their mouths at a dental visit or a dental checkup and the dentist takes a quick look and begins to tell them their life. "Oh, Mr. Smith, you might be a little bit stressed today. I can see from the way your tongue is really scalloped." Or, "Mr. Jones, you've been grinding your teeth at night. I can see that your mountains are a little bit worn down." Or, "Mr. Brown, did you forget to tell me about whatever it is you're taking or whatever it is you're doing that's drying out your mouth?" You see, our mouths are vitally important gateways to the rest of our bodies. And the health of our oral cavity greatly mirrors the health of the rest of our body. For instance, a dentist could look into a patient's mouth and accurately declare by just visually looking or palpating that Mr. White, you have just recovered from a cold, or you've just had a systemic infection. You see, the mouth and the state thereof of the mouth mirrors the health of the rest of the body. Even some vitamin deficiencies can be detected by the state of the mouth and the gums. Ancient Chinese medicine has even linked teeth with different parts of the body in terms of being on the same energetic lines. The mouth is very important and is linked with the rest of the body. And this cannot be overemphasized. This is what we're going to be talking about today. My name is Dr. C.A.Botchway, and I am a general dentist at Sinai Dental. The mouth is very important and so closely linked with the rest of the body. For instance, we use the mouth to smile and to change the atmosphere within us and around us. We use our mouth to eat and to nourish our bodies. We use our mouth with the help of our tongue, our soft tissue, our palate, to cause breath to vibrate at certain frequencies into what you're hearing now: sound, speech, and language with which we use to communicate. We use our mouth to cause breath once again with our soft tissue, with our brains, with our brain, with our soft tissue, with our tongue, to again cause it to vibrate at different frequencies into what we call singing, expressing the innermost thoughts of our soul that draw us swiftly into another state of being, evoking and sustaining our emotions and thoughts. All of these things are done with the help of the mouth. If we neglect the mouth, we neglect the rest of the body, because everything that affects the mouth will also affect the body. Think of the mouth as a sort of a whistleblower or a gatekeeper of the body. Now, here is the really interesting part that I should just mention, but not go into in this seminar. What affects the body has first been birthed in the mind or the soul, entangled with the thoughts, the emotions, and the consciousness. And it will determine if the spirit or the life force will flow through the body or be stagnated. So body, soul, and spirit are intermingled and entangled. And if we try to treat one aspect without regard or respect or knowledge of the connection with another, are we doing our patients a service or a disservice? Today, and for the purpose of this seminar, I'm only going to be talking about our mouth and how it is linked to the rest of our physical body. As I've said, we use our mouth for so many things: talking, like I'm doing now, eating, and day in, day out, saliva is flowing, food is churning, teeth are chopping and grinding as we cut up and crush up our food and release the nutrients that are needed to nourish our body. Now, once the mouth has done its job of churning, crushing, and grinding the food disappears down the extension of the mouth into the esophagus, and then it disappears, never to be seen again in the same form again. So in a way, the tube that is connected from the back of the mouth all the way to the end of the body is also a part of our concern, and that is why that in this seminar about the mouth, we're going to be addressing a very important extension of the mouth also, quite briefly, and that is the gut or the GIT tract. Okay, back to the mouth. Okay, back to the mouth. In order for your mouth to be able to do a good job and to get the food chopped up properly and to provide nutrients for the body, in order for your mouth to be able to help you to speak, to sing, to communicate, it has to be working in a healthy manner. What do I mean by healthy? Let's think of a tooth as a mountain. And in the valley, let's imagine a small gutter which catches all the fallen food bits and debris. If this debris stays there in the gutter without being washed or flushed out regularly by the saliva or cleaned away by whatever methods we have. Some people use chewing sticks, some people use chewing sponges. In the West, we use toothbrushes and toothpaste and floss. But if this stuff stays in the gutter without being moved away, the bacteria in the mouth uses it as food for energy and produces waste products which are acidic in nature and which destroy the gum margins, creating gum pockets which catch more bacteria and debris and smell really bad. Teeth have to be clean, sturdy in the bone, and there needs to be no bacteria sitting in the gum gutters around the tooth, and there needs to be good saliva washing away food as debris builds up. If teeth are encrusted with calcified debris or thick bacteria-filled plaque, not only will the teeth look and feel and taste disgusting to the tongue, but toxins from the implanted bacteria on that biofilm will destroy both the teeth and the gums by producing acidic, toxic waste, causing the teeth to rot, become brown, be filled with soft, bacteria-filled debris, and to rot, and the tight gums will become loose, bleed, bone will dissolve away, and the teeth will become wobbly, loose, and eventually fall out. This can all be accomplished with a ghastly appearance of the teeth and a very foul odor or smell. So the result of having a dirty mouth, an unhealthy mouth, is multifaceted. And I'm just going to just mention a couple of them. Your mouth, your breath will not be good. Your breath will not be good. Your mouth will not smell good. Your teeth will look bad. When you smile, there'll be holes and breakages and things missing. you're going to have pain. You won't be able to taste your food as well. You may not even be able to break up your food or grind your food as well, which could lead to food that hasn't been mixed and churned with the enzymes of the saliva being swallowed and therefore not digested properly. Your mouth would taste bad and taste acidic. Lots of people lose their confidence when they can't go up to somebody and whisper, or they can't go up to somebody close and talk or say something because they're afraid that their breath is really bad, or they're afraid that their tooth is going to drop out, or their tooth is going to crumble, or somebody goes to a party or a barbecue and they're afraid to eat because they don't want their tooth to snap. And so they have problems smiling, they have problems laughing, and they have problems talking. Many people have asked me, why do I need to brush? Why do I need to floss? Why do I need to do all of this stuff on a routine and regular basis, which we call prevention? And my answer to them is most of these steps would be not such a huge deal if there was something missing from our diet, and that thing is sugar. So as we go further into the seminar, in the second phase, part 2, I'm going to be going into depth and into detail, and I'm going to be talking about the effect of sugar on our mouth and on our body. I'm going to be talking about the effect of acid on our mouth and on our body. I'm going to be talking about the effect of alcohol on our mouth and on our body. I'm going to be talking about the effect of cigarettes on our mouth, our oral cavity, and our body. I'm going to be talking about the effects of pot, grass on our mouth and on our body. The effects of dehydration, which comes mainly from coffee, caffeine, and high caffeine drinks on our mouth and on our body. I'm going to be talking about, this is a really big one, stress on our mouth, on our body. I'm going to be talking about inflammation on our mouth, on our body. And of course, we all know about the link between inflammation in the mouth and inflammation in the body linked to the heart. Okay, so we're going to be talking about that, and we're going to be going really into detail with that. And if you join us in the second part, it's going to be interesting. The key to a clean gateway is not a set of rules you follow when you feel like it. It is a total lifestyle change. It's a balance of your body, your spirit, and your soul. What is the point of having the whitest and most perfect veneer-like teeth if you never feel joy and want to smile and release that energy into the world? On the opposite keel, what a wasted opportunity when you want to smile and laugh and embrace the world with your charismatic stories and your charm, and all they feel embraced with is funky breath. There are many people who believe that it is the job of the dentist alone to maintain their mouth in optimum health, but in fact, they themselves play a vital role to partner and to commit to a lifestyle in which the mouth acts as the gateway to the rest of the body. The mouth acts as a mirror to the health of the rest of the body. The mouth acts as a sort of a mechanism to show whether they are actually balancing things up. If you're keeping the mouth healthy and clean, the chances are that everything else is balanced. If you don't have time to clean the mouth, then something is happening that has taken us out of balance. It's very important for us to be able to see the mouth as a gateway. And we have to understand that where there's a gate, there is a wall. Now, we've talked a lot about a wall. There's walls going about in politics. We're not going to talk about that wall. But behind a wall, normally there's something precious to protect, which is at risk of outside things. And so the gate is at the opening of the wall, and not everything is allowed to come in. So it is the gate's job, the sensors in the gate, the security at the gate, to screen and to decide what stays out and what comes in. And when the mouth decides that it is not allowing in certain things, the mouth is shut. Only a person who owns the mouth ultimately has that ability to shut the mouth, to censor what comes into the mouth in terms of food. Okay, so we're talking about physical food here. If you want your mouth to be clean and healthy, then you have to change what you eat in addition to cleaning. You have to cut out sugar. Remember when we talked about how the mouth was related to the gut? Well, what we eat affects the gut and ultimately the mouth. What we eat allows us to get nutrients into the body. How we eat, when we eat, how long we chew, how well we churn the food. If we're in a hurry and we don't have time to eat, if we don't have time to drink, if we guzzle everything down super fast so that the food almost goes from one piece down into the esophagus, there's an effect. So from the moment we place food in our mouths and start chewing, digestion really begins. Ptyalin, an enzyme, breaks down the starch in our mouths. Our mouths are defined to have certain foods that are rich in nutrients, foods that are alive, foods that can make our mouths and the rest of our bodies bloom and blossom. But accidentally, we began to eat these other things that are dead foods. They're not real foods. They're a conglomerate of our attempts to isolate certain parts of food that make us feel good. High fats, high refined sugars, processed sugars, process this and process that, preserve this and preserve that, neglecting to consider that there's a reason why sugar in its natural form is presented with the entire fruit. So here is sugarcane, as sugarcane with thick fibers stimulates copious saliva flow as we chew it, ensuring that we're not able to consume as much at one time. When we have taken only what we want from food and thrown away the rest of the food, we have unwittingly violated the sacred design of our food, and we have created a poor counterfeit substitute that cannot begin to measure up to what exists in nature and our bodies can digest easily. You see, our bodies can easily digest and easily take the nutrients from anything that is living. When I say living, I mean if you take that thing and you put it in the ground, it will grow. If it will not grow, it is not living, and it does not have what our bodies were designed to have to optimally function. So what do we do? Really, there are two main steps, and the steps are easy. First of all, we need to clean out all of the junk that has accumulated on our oral cavity. That means that we need to take whatever tool that we have available to remove the plaque, the buildup, the debris, whatever dead cells are on the face of the tissue. The tissue should not be bleeding. It should be brushed, it should be cleaned, and there should be no blood. There should not be broken down, decaying pieces of teeth, for instance. So all of these things really need to be cleaned out. And then once we've cleaned that out, we've cleaned out the debris, then we need to make sure that we begin to put in the good stuff. We need to clean out any traces of sugar, and we need to put in the good stuff. And that means that we need to commit to a regime using our 3-step prevention. We need to embrace a new diet of fruit, vegetables, see our recipes. We have some good recipes coming up, juices, and we need to restore a balanced environment. Now, the environment is very important. The environment has to be very alkaline. It has to be one in which we're constantly not changing the environment to give the bacteria a head start, but we are eating things that our body wants and needs nutrients from to build healthy tissue in our mouth, fruit, vegetables. And the removal of sugar is paramount to this plan. We're going to be talking about it in detail in part 2. Please join me.